Speaking about professional siblings, I thought how challenging is it to present before the professional family. It's not a simple thing. So hello fellow professional brothers and sisters. My presentation today is related to us, professional siblings in Balint Group. And so before I present my paper, I want to invite you to a short guided imagery experience concerning your biological siblings before I go on with the paper. So I will ask you, it is a 2-3 minutes experiential process, so please sit comfortably in your chair, close your eyes, try to relax. Take 2-3 deep breaths. Try to bring to your imagination a situation in which you have an interaction with your brother or sister. It can be an interaction from your younger age or from your adulthood. It can be a face-to-face interaction or in a family encounter. Imagine the picture, the situation, the scene, the room, the atmosphere. What do you feel in your heart? What do you feel in your body? Take 2-3 short deep breaths. In a minute or two, you will open your eyes and come back to this room where you sit comfortably in your chair. So, please open your eyes. Welcome back to the lecture room, and thank you for your cooperation. Buying groups often include colleagues from different healthcare professions. At one of our Balint Group Leaders Conference, the leader in the opening circle raised the question of our needs when we come to Balint. Some declare the desire to learn, others to seek mutual enrichment, to working together in the same professional house. An experienced family doctor named Ruchana, a newcomer to Balint, inquired humorously, "Would you adopt me into your family, into your Balint family?" In another leaders' conference, a family physician pondered, "Why do mental health professionals come to Balint? Family doctors obviously benefit from Balint, but don't mental health professionals have their own groups?" Towards the end of the discussion, somebody suddenly raised the question as to the important responsibility we have for each other in the group. We were struck by the thought that perhaps the connection we have is stronger than mere colleagues, and rather more like a relationship among professional siblings. Can you please pass the... More than parents, okay. Yeah, okay. More than parents, more than educators, more than friends, lovers or pets, our brothers and sisters shape us to be who we are, said Eliza Albert in her book Freud's Blind Spot. As a young child, Freud was greatly influenced by the birth and sudden deaths of his younger brother Julius. Julius was born when his brother Sigmund was 17 months old and died 5 months later. In a letter to one of his confidants, Freud confessed, "I welcomed my younger brother with a malice and true infantile jealousy. His death left the seed of guilt in me." However, Freud ignored the importance of siblings in his case descriptions he wrote. If indeed we could consider each other as professional siblings, then how does the integration of our different professions affect the process in the group? We'll discuss this through examples from Balint groups. And I take this opportunity to thank my friend and colleague Stanley Rabin, who most of you know. He led one of the groups with me, and I thank him for his contribution. Okay, the case number one, patient number one. In Balint group, the day after the opening circle, I mentioned above, Muhammad, who wished to be adopted into our Balint group, hastened to ask, "I want to introduce my patient number one." Emotionally, she continued, "I want to share with you the treatment of my father. You can see that I've been in this profession for a while. I'm almost approaching retirement. I'm an only child and accompanied my father in his cancer battle for 2 years at the end of his life. I felt that I had to save him, and so I did everything I could for him, but in the end nothing helped and he passed away. I'm left with feelings of guilt that I didn't do enough for him." A heavy silence hung in the group. The participants looked at each other uneasily. They were ambivalent, torn between identifying with the presenter and following Balint rules. The story was moving, but the dilemma existed. How should we deal with it? The participants then shared stories of dealing with their own parents' illnesses, and their participation was very intimate and open. The leaders looked at each other, but said nothing. There was an atmosphere of a shared faith and empathic identification with the group. Suddenly, one of the veterans members commented with frustration, "Well, my dear friends, I feel very alone in this group today. I plan to share the treatment of a very special patient of mine. He was not my father, but rather a patient at the clinic who reminded me of issues related to my father, rest in peace. Yes, I too lost my father under difficult circumstances, of which some of you know because most of us know each other for a long time as Balint members. However, somehow in this group today, I don't feel comfortable talking about it." The group members felt uneasy. Should they continue sharing a personal experience or not? It didn't seem appropriate to stop the process, seeing it as it had already begun. It was evident that the sibling identification with the presenter was so strong that the Balint rules not to deal with personal issues had been forgotten. This process had flooded one of the participants with memories that he didn't want to share with the group. Who should the leader protect? The presenter, the participant who didn't talk, or the group as a whole? The memory of the sharing in the opening circle of the conference, when all the professional siblings met, was surely fresh in their minds, and perhaps it affected both the group leaders and the participants. Had the participants felt like the presenter's siblings and protected her in a kind of a shared fate, professional siblings, even at the expense of deviating from the Balint rules? Should the leaders, like parents in a family, protect the participants who share a similar childhood dilemmas? Or should the rules have been followed? The group is not meant to be a therapy group. How should the in a Balint group have dealt with the emotions of the participants who protested? The case number 2, the lost sister. In another conference, a social worker presents a dilemma in Balint group. I'm a part of an interprofessional treatment team in a psychiatric day hospital. I take care of a 19-year-old girl who had been in the hospital for 2 years due to a mental breakdown, accompanied by prolonged functional decline. At the beginning of the hospitalization, it was thought that she was suffering from schizophrenia. It was thought, later it became evident that she had been sexually assaulted in the family. She reacted in states of dissociation, as well as repeated suicidal threats. I am a case manager, said the social worker. The team, which consists of psychologists and psychiatrists, now want to release her from the day care hospitalization. However, I feel an emotional commitment to her, and am afraid of suicide attempts and that she won't manage outside. The mental health professionals in the group seem to understand the complexity of the case and sympathize with the dilemma of the social worker. They understood that she felt like a parent who needed to take care of her child. However, the leaders noticed that the family physicians were relatively quiet in the group and asked themselves why that might be. Therefore, when a request came from a family doctor to share something very personal that is not easy, the leaders permitted her to share, although it was towards the end of the session. The doctor then shared that as a young girl, she had witnessed her sister's suicide and had been left with deep sense of failure. She described that it had been a very difficult experience that shaped her personal life and later also her professional life as a doctor. Everyone felt great empathy for her pain. The leaders were in dilemma whether to allow the group to respond to such a painful emotional experience only a few minutes before the end of the meeting. In the end, they did allow the discussion to continue for a short time. After the meeting, the facilitators felt that an opportunity had been missed out and spoke with the participants briefly after the session. They were concerned that she would be upset after bringing a very distressing topic that was not discussed enough. She admitted that she did feel let down. The emotional sharing in the group and the nature of the case presented caused us to once again ponder. Can we think of Balint as a group where professional siblings sit together and share dreams, personal pain, fantasies, and professional dilemmas? Do the group leaders act as professional parents from different professions? We all carry images of an ideal brother or sister or a preferred sister. A large part of our life as siblings is conducted in the space between these optimal images and the painful reality. Meeting in the group may cause painful issues from the past to rise, as happened here. The case number 3, physical and emotional contact. By the way, the pictures are brought from, maybe you remember, the Family of Man, the photographic series of 50 years ago. Yes. So illustrations are from there. In another group, a woman family doctor introduced the case of a 55-year-old maid with no family, a long-time patient of hers. He had been hospitalized to clarify various physical complaints, but no organic source was found. He asked the doctor to make a home visit. During the visit, his behavior was erratic. He didn't get out of bed, refused to talk or answer questions, and he asked that she examine him physically. She hesitated, in the absence of an urgent indication for a need to do so. The family doctor consulted with the group about how to proceed with this patient. A long silence ensued in the group. To get out of the impasse, the leader suggested that the group try to imagine what kind of person the patient was. Dana, a family doctor, said, "I don't have to imagine. He reminds me of the appearance and behavior of a patient I treated in the past. He was unkempt, he had bad smell, which made it difficult for me to examine and treat him." Moshe, a psychologist, said, "I can visualize a person who has a criminal characteristics, or he had an abusive past and maybe the doctor sensed this." The group leader said, "Fantasies are hypotheses that can be worked with in therapy to understand our patients and why we are at a standstill with them, as is done in mental health." Shira, a family doctor, protested, "But we are family doctors. We have to physically touch the patient to examine him. I'm in close proximity to him in his own house. That's hard for me. We don't work with fantasies." A silence ensued in the group, which was broken by Rafi, a family doctor. "I'm a family doctor and my sister is a psychologist. When we meet in familiar settings, it's not always easy for us to share with each other the cases we treat. There is a sense of a distance between us. Each of us has difficulty describing exactly what we do when we work with patients. Maybe it's something about touch, about connection, a little bit like I feel now in this moment in the group." A sense of relief was felt in the group. Something had become clear. In the parallel process, among the group of professional siblings, a split was created. On the one side were the good understanding siblings from the mental health field, with therapeutic imagination and emotional insights. On the other side were the difficult siblings, the family doctors, who stand at the forefront of treatment, do the hard work, are involved in close proximity and physical contact with the patient, and sometimes find it difficult to openly share their feelings of disgust and rejection. In conclusion, thoughts about parental leadership aspects. Sibling transference is not limited to therapy alone. It can contribute to family-like cooperation in other groups with strangers, especially when the environment symbolically duplicates a harmonious family atmosphere. Participants in long-standing Balint groups may be emotionally involved with their brothers or sisters in the group, which may contribute to a positive familial atmosphere. The case stories highlight the tangle of emotions and the loyalties that exist in the relationship between professional siblings, especially when the case takes us on a journey to the threshold of our homes and families. The first case of a physician failing to save their father triggered in the group a kind of sibling identification which challenged the leaders. They were, in a sense, drawn into a parental overprotective countertransference. Perhaps the leaders, in having to decide whether the case was suitable for Balint group discussion, were afraid to be thought of as a bad parents in front of an all-loving siblings. Are cases of physicians failing to treat or save a close family member legitimate Balint cases? In the second case, a mental health dilemma in a group led by two mental health professionals. Leaders might have been drawn the professional siblings into an idealization parental transference, in which they wanted to please the idealized parents/leaders. Did this lead the team to miss the more troubled siblings, the family doctor? In the third case, the discussion of a difficult somatic patient caused a split between mental health professionals and family physicians. Was the split a parallel process or a competition between the preferred and the rejected sibling? The sharing in the group of a personal sibling issue helped to resolve the split in the group. Psychological concepts, myths, Jungian archetypes try to conceptualize the relationship between siblings. They range from twin fusion, admiration, idealization, jealousy, mutual dependence, to hostile dependence and rejection. Sibling and parental transference, such as competition, jealousy, anger, etc., are feelings we often keep to ourselves in Balint groups and in life in general. What a challenging territory to explore. Thank you.